Hello everybody, this is Ronnie Smith here with another video update of what's been happening in the Ralph H. Johnson VA Medical Center in response to COVID. First we'll talk about some quick updates on our data related to COVID. Yesterday we discharged the one positive inpatient veteran that we had in the hospital, so currently we have no positive inpatients. We do have 10 veterans that are positive that have tested in an outpatient setting that we're monitoring them while they stay safe at home and helping provide follow-up care as appropriate. And we have 3 PUI employees and 28 PUI veterans who are people that have been tested. We're just waiting results back, and we'll provide the appropriate care and follow-up once we get results back. Our biggest news we had was last week is that we were nominated to be the pilot site for Vision 7 for reopening of services. You've already seen some communication about that process, and that we were able to start moving forward effective on Monday. For us, we had already started thinking through plans on what we needed to do to be safe, on what areas we would think about reopening and how to do that in a phased approach to make sure that we are able to provide services to our veterans that are appropriate for face-to-face, but do it in the safest environment possible. We're very fortunate here in Charleston that we've had a very low volume of positive COVID patients and staff, and so it was a natural choice for us to be the first in our vision to try to move forward. We have been doing a lot of modifications to our environment of care. We've had our masking policy in place. We'll continue to do screening for all visitors and staff coming in, and several other steps we've taken to try to create safety in our environment. We'll be moving forward in a phased approach, doing slow increments and increases, such as slowly expanding the number of procedures we're doing in the OR and other ambulatory procedures, and then slowly increasing the number of visits we're doing through some of our outpatient clinics. And we'll be doing that over the weeks to come. What will be very important is we continue to monitor how much PPE we have available to us. We're in a very good position now. We want to just make sure we continue to be in that position, and make sure that we learn lessons quickly and make sure we can address those problems as they present and move forward for the next step, and make sure those issues are resolved. When we have any safety concerns, we can address those. And use our HRO principles that we all live by every single day. Our staff are wonderful. We've been getting a lot of great suggestions through our Q&A email group, but if you have any other suggestions you'd like to provide to us on how we can be better prepared as we expand and move forward, please email us at the email group that you see on the screen here. Primary care and mental health for us, they've been operating in basically full capacity, and I really appreciate all the work they've been doing of providing great care in a virtual setting. So we'll continue in that modality, trying to provide virtual care where appropriate, using video connect as much as possible, and then using face-to-face where it is appropriate as we move forward. For those coming through for screening, you'll see some updates to the questions that are being asked. The CDC guidance has changed and will continue to change over time, and we'll be adjusting that as well. So you might hear a few different questions being asked of you as you come through for screening going forward. And we'll continue to update as the CDC updates their guidelines. One additional thing that we are adding to our screening process that VA is moving to no visitors under the age of 18 allowed. So that is another slight adjustment to our screening process on who's coming in to continue to control our environment, make sure we're keeping great social distancing, and just ensuring those that are here for a reason. We'll continue to kind of check appointments and monitor who is coming into the buildings at all of our sites of care where we're seeing veterans. I would like to say thank you very much to the Savannah CBOC staff for their participation in a virtual town hall that we held last week. It was great to be able to touch base with the Savannah group during that event. These virtual town halls have been a great way to be able to reach out, even though we can't get there physically. And so we'll be continuing to do that for the foreseeable future for other CBOCs. I want to say thanks for everybody that participated in all the events we had over the last week for Hospital Week and then previously for Nurses Week. And also say thank you to our research and police staff that also celebrated Police Week and Research Week here recently that were a little bit overlapping. Appreciate all the work that you are doing and all the support you're providing to all our staff and our veterans, and continue the great work I know you'll be doing going forward. This week is Healthcare Technology Management Week, so I want to thank our team of electricians and biomed staff that work in HTM and the additional staff. They're doing everything they can to continue to support all of our clinical staff and the rest of our team throughout all of our sites of care. And I also want to say thank you for all their creativity. A few of us actually visited their area today to get the latest update on what they're doing with 3D printing. They continue to do amazing work and creativity, 3D printing face masks for PPE, working on nasal swabs that will be a pilot site for providing nasal swabs to other facilities using 3D printing technology, and just the outstanding work and creativity that they bring to the table. And that is all I have for today, and we'll do another video update soon. Stay safe, keep your social distancing, and make sure you wash your hands with soap and water. Thank you.